Now that you've spent some time thinking about your personal values and your personal life goals, it's time to think about what happens if you find yourself in a situation where you are unable to make healthcare decisions for yourself. Let's say, what if you were suddenly in a severe car accident, or suffered a major heart attack, or were otherwise unconscious and could not speak for yourself? Now, of course, I wish this wasn't the case, but we see this all too commonly in hospital patients. Who, as physicians, should we turn to tell us that you've thought seriously about these things and want your wishes to be followed? Maybe you are saying to yourself, well, hey, everyone knows my values and life goals. My spouse does, my oldest child, my parents, my siblings, even my friends, and they can automatically speak for me if I'm unable to. Now, that may be the case elsewhere in the United States, but in California, it's frankly not so simple. We have no hierarchy order. And what does that mean? It means that no one person automatically speaks for you if you are unable to speak for yourself. And that is why it is critical that all adults living in California over the age of 18 fill out an advanced healthcare directive. In addition, unlike in other states, the California Advanced Healthcare Directive has two parts. First, you can name a healthcare agent, and second, you can create a living will. And this Advanced Healthcare Directive is actually legal under Document Probate Code 4701. So when thinking about choosing a healthcare agent, which you will also hear described as a healthcare surrogate or a durable power of attorney for healthcare, there are a few things that I think are very important for you to know. Number one, you have the right to name almost any adult to be your agent. However, you should select someone who you trust, who will follow your values and healthcare choices, and who is knowledgeable about your wishes, about your goals, and about your beliefs. You can, in fact, choose a member of your family, such as your spouse, an adult child, a sibling, a parent, or you can choose a close friend, or frankly, anyone else you see fit. However, the following people cannot be appointed to be your power of attorney: your doctor or any member of your healthcare team, or an employee of a residential care facility or community care facility where you are receiving care. As a general rule, however, the person you do end up selecting should not only understand your wishes, but should also be comfortable going along with your choices. And if possible, they should live close enough to you to be with you in person if, God forbid, the need arises. When making this decision, consider also if this person is emotionally capable to make decisions on your behalf and can actually manage conflicts among family members, which often happens. It even happens with conflicts among the medical team. Your agent can make, as can you, almost any treatment decisions, such as consenting for treatment, refusing treatment, hiring or firing your hospital or your doctor, or even withdrawing from treatments altogether, even if it might lead to your death. You also have a right to limit the decision making, and that's why it's so important that your choice of a surrogate is both personal and important to you to make to reflect your values and your goals. Now, if you wish, you can also select alternates who may act if your primary agent is unavailable, unable, or frankly unwilling to serve. In general, I believe choosing alternates is a very good idea. Your alternates, in fact, have the same decision-making authority as your primary agent. In fact, in California, the California Advanced Healthcare Directive allows you to even name a second alternate. However, your agent's responsibility to make decisions on your behalf only begins when you are unable to make decisions for yourself. If in fact you regain decision-making ability, you then immediately return to making your own healthcare decisions. Your healthcare agent or surrogate named in this form, however, cannot make financial or other non-healthcare decisions for you. Yet you can select the very same person to perform both tasks if you so desire. And if a conservator is being considered for you by the courts, then this advance directive form helps to nominate your choice of healthcare agent for that court-appointed role.